I guess my role is to get the ball rolling today, and to some extent it's about talking about occupational cancers. Now I have to say I'm delighted that you're all here and we've got a pretty good roll up today, getting close to 100 people who've registered. But I have to say I was fairly worried that registrations were fairly modest, and it forced me to think about who thought that this issue was important, who really wrestles with the issue about occupational cancer exposure and wants to do something about it. Now clearly you do, because you're here and you're investing a day, and I'm delighted that that's the case. But it seems to me that it's one of those issues that people don't tend to give a lot of attention to until it lands in their workplace, until it lands in their lives, and then it becomes a very, very big issue. Clearly we've made a lot of progress in this space, and no one is starting today with alarm bells screaming and drama being banged from the highest bell tower. There's progress, there's history, there's successes that are worth acknowledging, but there's still a lot more work to be done. It's an ongoing process. Because of the report that I'll be talking about in a moment, I've been doing some radio over the last 24 hours or so, and it's fascinating to hear a journalist's perspective on these things. And I offered the example of glyphosate, and I suspect we'll hear a bit about that today. Lynn Fritchie's in the audience. Lynn was involved in the assessment of a range of pesticides that the International Agency for Cancer Research did, and glyphosate was amongst that group that was assessed and was elevated to a 2A, a probable cause of cancer. Now, for those people who've been working with glyphosate for 20 or 30 years, that's a disturbing story. For those who are working with it now, they can do something about it. Either we can look for alternative to serve that purpose, or those who are using can be far more careful with it. What about those who've hung up their boots and aren't working in that space anymore but have been working with glyphosate? How do we deal with that as an issue, and how do we ensure that those people, if cancer comes along as a result of that, they are properly compensated? So what I want to talk to you as a kick-off this morning is about the presentation of the data that's available to us from our friends at Safe Work Australia. We have some Safe Work folk. I haven't seen them this morning. Is anybody here from Safe Work yet? They were going to be coming. Can't see anybody. If you are here, see me at the morning tea break if you would. That'd be great. And they've been very helpful in terms of making their data available to us, which comes from the various state and territory compensation entities around Australia, which has identified those claims that have been successfully made with regard to cancer through the compensation system in Australia. But before I go any further, I'll acknowledge the work of the people who helped put this report together. In my own staff, there was Lauren Zappa and more recently Alyssa Tomic. And Caitlin Cameron made a contribution as well. We've got reviews from members of my committee, Deb Glass, Lynn Fritchie, Kristen Miller, Julie Hill from Safe Work Australia, and Richard Webster, also important in terms of helping some of this. The report is absolutely based on the data that's made available through Safe Work Australia, and it wouldn't have been possible without those folks. And essentially what we found was some fairly big and frightening numbers. What we found was that occupational exposures, as per work of people like Tim Driscoll and Lynn Fritchie, the estimate is roughly 5,000 new cases of cancer, and we'll be hearing more about the work that that group's doing later today. Their work also suggests that roughly 3.6 million Australians could be exposed to one or more carcinogen in their workplace. When you think about the ubiquitous nature of the sun and it being connected with skin cancer, that's a very big contributor to that, but by far away not the only one. There are many more. And there are priority carcinogens that are applicable to the Australian environment. The other key issue is that this compensation data made clear that there was less than 8% of the expected number of cancers that had some occupational contribution for which compensation was actually paid. It suggests that there's an enormous level of undercompensation with regard to the issue of cancer. So that may well be as a result of a lack of awareness either of the worker or retired worker themselves or the health professional who they're dealing with when it comes to the diagnosis of their cancer. It also acknowledges the inherent difficulties and the challenges of identifying specific causes of cancer and all of the complexities that go with that. Going down to the numbers, over that period of time of 2000 to 2012, the data for which we could get access, 4,745 successful claims were being made. Now, there's various groups that are excluded from this. There's compensation made through the direct litigation process. There's various entities that have their own mechanisms in place. WA Police is one example, and there's a few others. But this is a fairly substantive kind of capture of what is likely to have been paid in terms of compensation. So that averages out at just less than 400 claims per year that have been paid. But I thought, why should I present you that data unless I know what the total number was? So the folks at SafeWork last week sent me the numbers, and I was astounded to learn that there was 4.16 million claims made over that same period of time. So 2000 to 2012, 4.16 million compensation claims. That astounded me. You might have guessed that. You might be familiar with that data more than me, but it was a frighteningly big number from where I sat. Or about 360,000 cases per year. Now, I've already mentioned sun exposure as being a major contributor to that. In terms of the numbers, sun-exposed related cancers are made up for more than 53% of the total number of claims, and asbestos made up 26% of those claims in terms of sheer numbers. And so that's a representation with mesothelioma, and then there's a number of points at which you can see the skin cancer ones. It's the second bar down, let's see, it's the fourth bar down, it's the fifth bar down, it's the sixth bar down. So they're separated into various versions of skin cancer and the way in which the claims data was accumulated. Now, it comes to the cost, again, over that same period of time, $360.5 million was paid out, an average cost of about $30 million per year. But again, this is out of a total compensation pool over the same period of time of $54 billion. So that's about $4.5 billion per year. And you won't be surprised to learn, by the nature of the occupational safety and health system and specifically the compensation system, 3/4 of those were due to injuries. So cancer claims, in terms of dollars, made up 0.006% of the total claims paid. So we're not talking about a huge proportion of the amount of money being paid when it comes to cancer. So compensation in terms of years, at the low end, about $15 million in 1 year. In 2000, 2001, up to 2006-07, it spiked at $42 million. And again, for those who know anything about the system, won't be at all surprised to learn that mesothelioma made up 73% of the total costs of claims. And so that obviously indicates the severity of the disease, but also it acknowledges the clear connection that everybody in the community can make between asbestos exposure and the prospect of mesothelioma. The cost in terms of skin cancers and the cost of claims made up about 15% of the total. So that's essentially the same data represented on a graph, and you can see that purple line is the total number of claims, and the light blue line below it is the total cost of the mesothelioma-related claims. So you can see they're very, very closely mirrored. So asbestos is still playing an enormous part of the issue of occupational cancer in Australia, despite the fact that it's been banned in Australia in its various forms for many decades. So my message is a relatively simple one to kick the day off. We could get into a lot more detail in terms of what are the carcinogens, in terms of what are the things that we need to do about those, but that's what the rest of the day is very much about. So today is very much about exploring that there will be more detailed material looking at the issues about the causes and the solutions with regard to occupational cancer throughout the day, I hope. There's no doubt some progress has been made, and I've mentioned that there's been action with regard to asbestos, but that doesn't mean more doesn't need to be done. It certainly does. UV radiation, we've still got a substantial proportion of workplaces who have an outdoor workforce regularly exposed to UV radiation who don't have a clear policy in place when it comes to sun protection. Progress has been made in terms of tobacco smoke. You can actually go into a restaurant or a bar in most places and enjoy a smoke-free environment in Australia. But there are still places, casinos and the like, where people are exposed to environmental tobacco smoke. So into the future, it does seem obvious to say that we should be aiming to minimise exposure to any known carcinogens in the workplace. But there's also the challenge to ensure that we keep on top of those new issues as they arise, as assessments are made, as new data comes forward to identify what potential carcinogens are real carcinogens. So in the meantime, that we've got a lot more work to do. I'm delighted that you're here to help us talk about that through the course of the day. And it's great of you to dedicate one of your work days to help wrestle with this challenge. So with that in mind, I'll thank you, and actually, one of the other things I wanted to say was, as part of the event, this is very much about a discussion. We've got a, I think, comfortable-sized group of roughly 100 people, and I'm really keen to encourage discussion. So I'm keen to encourage questions from the floor. I like them through the course of presentations that I do. Other people prefer to keep them at the end, but I'm very happy to take questions along the way, either now or during the breaks, and have a conversation as to how we can take this issue forward. So I encourage you to engage your brain and become a participant rather than an observer to today's events. So if I can encourage you to do that, I will give you a chance if anybody does have any opening questions or comments. Please.
Will the content of those slides be made available?
Yes, I'm very pleased you've asked that question, because along with the videoing that we're doing today, this mob's really good. Not only do they do the video of the presentations, I just realised that you'd probably cut that as a promo. Bruce, will you cut that as a promo? You probably will. They'll do an edited version of the presentation, so you won't hear all the ramblings that I just did in the clips that will be available on both the Safe Work Australia website and the Cancer Council Australia website, but they'll also put the slides alongside those as well. So any of your colleagues, any of the people you work with, any people with an interest in this issue can capture the main presentations in an edited format, so that the key messages are available to folks who weren't able to make it today.